finally here for the shoulder joint maintenance massage. We're going to finish up with pectoralis major and subscapularis of the rotator cuff. We will do pec major first. Male clients, this is not an issue. You just work on the chest, expanding what I show you here. Female clients, you're going to have to go into kind of a special draping. Most of the time, if I need to work female client chest area, I actually just work through the drape. It works fine. If you in fact need to get down onto the skin and be able to work a little deeper, this is a good way to drape it. You have to have 2 towels or 2 pillowcases folded up, and you will have talked to your client beforehand, and everybody agrees this needs to be done. So you're going to say, all right, I want you to take these under the drape. I want you to lay them just like this over your breast and then hold them in place and tell me when you're ready. Are you ready? Okay, he's ready. You'll always have to make adjustments to this so you can work. If you're going to move the towel at all, what you do is you put your hand on their hand and you tug the towel from under their hand. But first I need to reposition her hands because I need a T of open skin down the sternum, across the top. So here, out like that, out. And so now I need to come down a little bit, let it slide. I need to come down a little bit, let it slide. Okay, so now I have that T, like this. Anytime you're working the chest on a female client, quick is the watchword. Get in, do it, get out. Don't dawdle. Little lubrication across the top, down the sternum. The warm-up is called cars at an intersection. Fingertips on the manubrium of your up hand, fingertips on the xiphoid of your down hand, and they both move at the same time. This actually usually feels pretty good. Okay. Now you can work upper pec very easily, supported finger. That, or insertion to origin. That, pretty easy. Now, for sternal attachments, what you want to do is spread your fingers apart a little. Get the pads of your fingers down in the intercostal spaces right where the rib cartilage comes into the sternum. So I've kind of got, that's the edge of the sternum, and I'm in the valley right off the edge. What I want to do is gently push out with those fingertips in that intercostal space a few times. Drop down a rib. They need to tell you if something feels tight, uncomfortable, painful, and usually you, as the therapist, will be able to feel something. It'll feel stiff or crackly or a little congested. What's going on right there? Uncomfortable?
No.
Okay, good. So you just keep working down one rib at a time. I would go the other side, work this way, and you finish the same way you started. And you're done. Go ahead and relax your arms down. Last muscle, subscapularis. This one will also require some communication with your client. They need to know when things are going to be uncomfortable, and I can pretty much guarantee this is going to be uncomfortable. And in fact, I do not often do this one, but if it's definitely a rotator cuff problem and the subscap needs working, this is actually the easiest, least invasive way to do it. But we've decided we really do need to work that subscap. She knows it's going to be a little less than comfortable, and we'll keep it brief. Now the approach, take the arm, you're going to work. You need to be able to see the axillary area here when you're working. Let's get rid of that. Right there. You ask her to just hold the arm up, don't really reach up, just hold it up. You're going to take your up hand so that your fingers and your thumb can point up. You're going to press the entire edge of your thumb down to the thenar eminence into her rib cage. Stay in front of the teres major and lat here. Stay above it. Have your thumb tip right at the arm. And just go straight in sideways. Boom. I'm on the rib cage. Once you're there, moves like this. You simultaneously, staying against the rib cage, press down and rotate down. Like you're trying to press through with your thumb tip to the table. And then you'll just hit bottom. You'll know when you're there. You'll just stop. We need to have an agreement. She needs to be able to tell me that's too uncomfortable, and then we'll just stop. Again, into the rib cage. Now I'm going down. Okay.
So far.
All right, now. Yeah,
It's
I
up there.
got the Elvis face there, so we know we're on
Yeah.
the bottom. Ask them to flex their elbows, still holding their arm up. Keep this part of the arm still, and what they're going to do is windshield wipers. When they do that, you will feel the subscap tighten and then loosen, and it'll tighten when they externally rotate, because it's an internal rotator. They're doing the massage, you're just providing a trap for it to run across. Just a few seconds. You come out, give a little range of motion, let it relax. And that is the shoulder joint.